Welcome to Toronto Children's Services' most recent updates module. Toronto Public Health made some changes to their guidance document on November 23rd and December 4th. This module provides a quick update on those changes. This module does not replace the existing modules. The full training modules must be viewed in order to meet the mandatory training requirements. The screening processes have been updated and the following processes are to be followed. If a child has one or more symptoms, they should stay home, self-isolate, get tested, or contact their healthcare provider. If a child's sibling or a child from the same household has one or more symptoms, they should stay home, self-isolate, and follow public health instructions. If the child has been in close contact with a person who has COVID-19, the child will need to self-isolate for 14 days, even if they do not have symptoms. If the child has travelled outside of Canada, they will need to self-isolate for 14 days. Please refer to the Toronto Public Health resource documents such as the decision guide, screening posters, and family attestation form for additional guidance. The experts continue to learn more about how COVID-19 can spread. Surfaces where respiratory droplets have landed is the least likely way to get COVID-19, but can still contribute to spread. Therefore, several changes have been made to the cleaning and disinfecting of play materials and other areas. Play materials can now be shared between children within the same cohort and are cleaned and disinfected on a daily basis and as often as necessary, or immediately if soiled or used by a symptomatic child. If the play materials are shared between cohorts, they must be cleaned and disinfected before the other cohort uses the play materials, and again once they have finished before the next cohort uses the materials. Cribs and cots are now cleaned and disinfected weekly, and the bed sheets are laundered weekly. Let's move on to the outdoor learning environment. Like the indoor play materials, the outdoor equipment continues to be cleaned and disinfected daily unless shared between cohorts and as often as necessary. For example, when visibly dirty, contaminated, or used by a symptomatic child. The play structures are not required to be cleaned and disinfected. Instead, children must perform hand hygiene before and after using the play structure. This slide speaks to operational practices during professional activity days and the winter break. Operators should continue to maintain the same cohorts wherever possible. However, it is recognized that enrollment may be lower on these days and additional staff coverage is needed to cover the full day program. If cohorts are combined during PA days, the following processes should be followed. Notify parents or guardians that the childcare cohorts will be combined and explain the childcare setting public health policies and procedures that are in place. For example, mask use, physical distancing, respiratory etiquette, hand hygiene, and screening practices. Maintain physical distancing within the combined cohort. Where co-located in a school environment, coordinate with the school board to access larger rooms such as a gym if possible. Provide more outdoor programming. During the winter break, it is expected that the cohorts may change due to children and staff taking vacation. Children, staff, and early childhood education students who are in attendance during the winter break must stay together within the same cohort for the duration of the program. That concludes the update module. Please inform your supervisor or director that you have completed this training module. We have provided a list of additional resources for you to access, and they can be found on the website along with this video.